Right. So, good morning, good evening to everybody who's joining us today. I'm going to talk a little bit about this little group that I ran for parent support on Facebook many years ago. The name of the group was Early Childhood Development and Parenting India. Um, the story actually about how this started was I was a young mother, and so were a couple of people in my age group who were colleagues from previous workplaces, and we were just talking one day saying that we would love to or we were home at that time with our young infants, but we also wanted to contribute in some way because obviously all the years of education and experience that we had, we didn't want to sort of we were feeling like we were not using that enough. So we started this group to talk to parents because we were getting a lot of questions as professionals. So the group was started in August and it ran for about 4.5 years. Um, when we closed it down in March 2018, we were at about between 26 and 27,000 members on the group. Most of these were mothers, definitely, because from the interaction, we could see that most of them were mothers, but we did have a lot of fathers and we even had some grandparents on the group. When we started the group, it was just, me. I'm a physiotherapist, a pediatric physiotherapist, and my friend who was also a pediatric physiotherapist. But then when we started talking about this with our other colleagues, a lot of them volunteered their time. Also, just to mention, this was a voluntary, endeavor. So by the end of it, we had occupational therapists, speech therapists, special educators. We also had a clinical psychologist on the team so that we could answer any question that came up and sort of address it in a very holistic manner. On the group, what we did was basically responded to parent questions. And then over time, we kind of curated some infographics and also attempted a few webinars, videos about, movements or play activities over the span of 4.5 years. The reason why we thought we wanted to review the data, we were definitely very engaged on the group. But at one point, we figured that we needed to know what kind of questions or what was the what was the underlying concern that the parent really had. Were they asking for information, or were they asking to, just make sure that their babies were on track, or whether they had sort of a concern, right? So if you think about what we do as therapists, you can sort of categorize that as your surveillance, screening, or an assessment. When we have all our follow-up protocols, right? That's what we do. Every well baby visit, we have a quick informal surveillance, look at what the baby is doing, discuss with the parents, what kind of questions they might have. At certain time points, we use a formal screening tool, and then definitely if that picks up some kind of red flags, we send them for an assessment. So we kind of wanted to know what our group was addressing in terms of this, protocol. And so we decided to look at the questions and analyze the data to, just help us figure out where we were or what we were doing. These are some of, the thoughts that we had in terms of were the questions related mainly to, discuss, say, myths that are very cultural in India, or just, basic information about what the milestone is and how the parents need to support that. Also, what we realized when the questions were being framed, that oftentimes the parent was seeking sort of a second opinion from us, right? I discussed this with my doctor. That's what they said. What do you think? And so we kind of also wanted to look into what kind of information is being given by the healthcare team, because we were also part of that team, right? And so those were some of our intentions to look at this data. So we couldn't really go through the 4.5 years. There were just too many questions to go through. So we sort of decided we will stop at 5,000 because we thought it was a big enough number to get some understanding of what the trends are. So we sorted about 5,500 odd questions. And we first started categorizing them into just four groups. That was development, parenting related, growth, and general. So for development, any question related to a specific milestone, that was development. Parenting was more about how do I, sort of how do I feed my child, or my child doesn't want to go sit on the potty, what do I do? So more like what the parent can their behavior or their what do you say their interaction from their end. So we labeled those as parenting. Growth was simply, my child is weighing so much for this age. Is that right? Those kind of things. And general was, what kind of books to read, what kind of toys to buy, those kind of questions we labeled as general questions. For this paper, we specifically wanted to look at motor because obviously for me, motor is, my priority. So we figured from this categorization, about 2,000 questions had a motor component. So we decided to look at those. We did not want to get into this questioning or second opinion kind of discussion. So we excluded those. We also had a lot of questions because the group got very popular and people found out that we were therapists. A lot of questions were also related to therapy. So the family was already receiving services, and then they wanted to know if, what they were getting, in therapy, was that right, or would they want to change something from it? So we excluded all of those. For this paper, we finally had about 1,300 odd questions. So we had all the admins, and we had about three interns to sort the data. And one of our authors was also part of the University of Illinois at that time. So she got a ethics waiver, for the study or for looking through the data. So the final data was categorized, by the age of the child. Because we also wanted to get deeper into the motor component, we, categorized it further into these 9 categories that you see here, and the question type, right? So the question type we sorted based on what we perceived the question to, be. Were they asking for information? For example, how do I do tummy time, right? Or for example, my child, what do you say? My child is crawling and attempting to sit. What can I do next? Those kind of things. Or at what age should my child be crawling? So, just information. They're not asking, that could be for any child, right? One clear category was the screening category, where they would say, my child is such and such an age. This is what they are doing. Is this right or wrong, right? Or is this age appropriate or not? So we kind of had that as a screen type of question. And then some questions were a combination of both. We couldn't really separate, them out into one or the other category. And so they remained this category of information or screen. Here's a little table to quickly run through some of the, questions, how they were laid out. As you can see, the numbers that are highlighted on the table, those are the maximum, in that milestone or that question type. So you can see that, the head controls are, oops, sorry. The questions on head control, most of the questions on head control were between the 3-month to 6-month age range. Similarly, questions about flow time or rolling were in that age range. For sitting, crawling, you can see the age is moving up. So basically, we were kind of happy to know that parents do know when the milestone is supposed to be achieved. They do ask the question in the right time. of course, there are some questions that are going further down the line as well, but then those were mostly the screening or the concern, raising the concern type of question. Most of the questions that you see, about, I think about 50% of the questions, were in the sitting and the standing category. From our experience, in on the group, looking at the questions, or that, what do you say, our judgment, or our, perception of what parents were asking, we thought that these were milestones that were very visible, right? A parent can see the child come to sit, or the parent can see the child standing, versus just head control or reaching for an object. Early on, those were not very obvious milestones for them, right? So a lot of the times, these kind of questions were not asked or not given attention to. So that was something that we thought the data supported the kind of experiences that we were having. Also, again, here, because I'm only presenting the data on motor milestones, but because we had the other categories, what we realized was that as the age went up, so say 12 months, 18 months and up, we got more questions on speech and language development, potty training, and behavior rather than motor milestones. So as you know, maybe the babies have achieved, the kids have achieved walking or achieve those motor components, the focus then changes to something else. Which was kind of fascinating, because we kind of, again, as motor therapists, think that, oh, there are so many skills that are coming up beyond walking that are, more functional, to be honest, in that sense, right? Climbing stairs, cycling, jumping, all of these things. And so we kind of were a little surprised to see that parents were not so concerned about some of those big motor milestones. Okay. Now, if we looked at the data categorized based on the question type, so like I said, the information screening or the combination of two, again, you can see that, the information or the questions that parents were asking information for were more related to, say, the upper extremity, or, play related, which was sort of not very defined for them. Like, what does play mean for an infant, or bringing the hand to mouth, what does that sort of, or my child is always bringing the hand to the mouth, so what does that mean? Is that a hunger cue even at 3 months, things like that. So most of these questions that were they were seeking information were some of these vaguer milestones, versus a lot of the screening milestone, or the questions with screening were very specific, very obvious, milestones that most parents are aware of. So like I said, we were kind of very happy to see that parents are seeking information around these expected ages as well. Because most of the times as admins, we thought we were answering questions that were more concern oriented than information oriented. So this was a little surprising for us, which was pleasant, of course, to know that parents are very, aware of what is happening. Even if maybe they were not that well knowledgeable about the nuances, major milestones, they all knew what to expect with the baby's development. Like I said, I feel like we felt like the easily defined, very visible, skill was, picked up more than some of these broader skills. And also, um, I feel like, some of the questions related to reaching, say, or, hand to mouth were also labeled as more behavior, that my child is stubborn, they keep putting their hand in the mouth, or my child is reaching only for this toy and not something else. So, the tone of the question was also a little more behavioral in the sense, rather than, just what is the expected skill that my child should have. Like we saw in the chart, most of the questions were between 3 and 18 months for the motor, questions. And the early focus, so the 0 to 3 months, where we want the baby to sort of be on the floor, be in tummy time quite often, have that experience of the spontaneous movements that, are occurring, that sort of go from or stop being reflexive and go more into that intentional what do you say, process of development. So that was missing for most of this, trend that we saw. And then, like I said, the questions that came up later, post 18 months, were again not very high or listed high on the motor aspect. They were more on the language and behavior and potty training. So these are just some of the questions that we have picked verbatim so that you have an understanding of what kind of interaction went on the group. And you can see that, some of them were very they're just seeking information, versus some of them do have a very significant concern. So one of the reasons that I wanted to write up this paper was also that a lot of times the therapist is separated from this process of screening. We generally get the referral, when the pediatrician determines that there is a problem. A lot of times we are not involved with putting information out there for parents or professionals, for that matter, other professionals, to know what could be some of the smaller red flags that can be picked up soon enough. For example, I feel as a motor therapist, I feel like pivoting is one of the simple, smaller milestones that has a big impact on how you are going to crawl or even walk, right? So when you're swinging your arms and you have that little trunk movement, the twisting movement, it begins with pivoting at around 5 months. And that is such a simple thing to look at, in a surveillance visit. And so I feel like therapists need to have a little more voice in some of these things, in advocacy, in awareness. And parents are seeking this information. They are hungry for this information. And so I feel like some of this teamwork can be improved on. Um, Also, I thought the group was a fun thing to do, because, like I said, sitting at home, I felt like that was something I could contribute towards. But also, we realized that there were so many people who sent us private messages or anonymous messages when that was something that Facebook could allow. Um, we had never like gotten a question from them. So a lot of people were just silent participants, but they got a lot from these kind of interactions or discussions on the group. And then lastly, of course, the culture, definitely has an influence. India is very diverse in that sense, even within the state. I mean, we have different states with different languages and different cultures, but sometimes even within our own state, we would have different parts of the state doing different things in terms of child rearing practices. And sometimes parents need some help moving through, those kind of, what do you say, advice that comes through from the family. So thank you so much.